Hi everyone, welcome to the YouTube channel fmge with Dr. Aman. In the previous video we saw about the intestine surgery. This video is going to be all about the liver surgery. Okay, so as we start the liver, I mean the surgical point of view, first you have to know about the anatomy in the brief. Okay, so anatomy means not the first year wala anatomy, I mean the surgical anatomy you must know. In the surgical anatomy you have to know the all the lobes of the liver. You must be able to identify the lobes of the liver in the diagram as well. Okay, and I mean they will just give the arrow marks and they will ask you which lobe is this, so you must know how to count the lobe of the liver. Okay, and the second things you must know that on which basis the lobes of the liver is divided, I mean the coinard segments. Okay, and second thing is the Cantley's line. You have to know about these two things, coinard segment as Cantley's line. Okay, I mean Cantley's line is when we draw the perpendicular line from the IVC to the gallbladder fossa. Okay, so that is known as the Cantley's line. You have to know about these two. Then the blood supply of liver is very important, you must know. And then there is one clinical scenario they might ask from this blood supply, that is the in the I mean this is related to the trauma. So we know, do you know the Pringel's maneuver? Okay, so Pringel's maneuver you have to know. We do the clamping of the patoduodenal ligament to check, I mean the what is the source of the bleeding in the case of the liver trauma. So you have to know about that as well. And then as we move ahead in the anatomy section, of course you have to know about the ligaments, like we have the falciform ligaments. Okay, so you have to know about the ligaments as well. If you have time you may go for that as well, because not very frequently asked, but yeah, sometime you may encounter in universities and during your PYQ, not in the FMG very frequently asked, but yeah, in the INSET PYQ or NEET PYQ, of course you will see. So this was all about the what. And yes, you have to know about what is the quadrate lobe, what is the quadrate lobe, you must know. Okay, which is the independent lobe, you must know. Okay, so this was all about the anatomy. In the anatomy we have one more clinical aspects, that is the bare area of the liver. You must know what is the bare area of the liver, I mean which lobe is bare area of the liver. And you know the cyst formation is mostly there located. You know we have the echinococal cyst, so read about that as well. Okay, so this was all about the anatomy. And when we come to the I mean the surgical I mean the surgery, proper surgery topic, that is the liver abscess. It's very important, it's very important, very frequently asked. You must be able to differentiate between the pyogenic abscess of the liver and the amoebic abscess of the liver, I mean. Okay, so these two is very frequently asked. They might give you CECT as well. I mean CECT means radiograph. They might give the ultrasound photographs, so you must be able to differentiate between them. Okay, so as you move ahead after the abscess, yes, you have to know about the what is it, the dissection of the liver. Okay, if you know the lobe of the liver from the anatomy, yeah, it will be very easy to remember the dissection of the liver. Okay, like we have the left lobe resection, right lobe resection we have. So in which resection which lobe is generally we remove, they ask. So you must know that. And after that as we move ahead in the from the liver surgery, first thing is trauma. Of course, trauma we have already seen about the trauma video. In this video we will not talk about the trauma, we will talk about the rest of other topics. So from the liver you must know about the some kind of cancers. Cancer is very important. You have to know just 3 or 4 cancer, that's it for FMC examination. Like we have the hemangioma. Okay, you must know the hepatic hemangioma. You must know the focal nodular hyperplasia. You must know the hepatic adenoma. Hepatic adenoma is very frequently asked. Focal nodular hyperplasia, CECT is very frequently asked. Okay, so you must know how to I mean the identify by just looking at the CECT that this is the focal nodular hyperplasia, this is the adenoma. You know, some clinical history is given, like OCPPL's history related to the hepatic adenoma. So you have to read about that: hemangioma, hepatic adenoma, focal nodular hyperplasia, and fourth thing, of course, is the very important, is hepatocellular carcinoma, HCC. Of course, is very important. Okay, so these 4 carcinoma you must know. Okay, from the I mean the liver cancer. Okay, so this was all about the liver. And if you talk about the gallbladder, of course the gallbladder is you must know about the acute cholecystitis and chronic cholecystitis. from the gallbladder point of view. You must know the boundary of the Callot's triangle. Okay, Callot's triangle, and what to say, the boundary of the Callot's triangle, and then you must know the all the radiological sign, like we have the Murphy sign we have when we press on the right hypochondriac region. So you must know about the Murphy sign, you must know about the Boas sign. Okay, so these two signs is very important, you must know. And then all type of the stone of the gallbladder you must know, is very frequently asked question. So I read about this stone as well. And then what is left? Yes, there is one the anatomical variant of the gallbladder, that is the Pharyngean cap. Of course you must be able to identify on the, I mean the CECT or on the ultrasound. They sometimes ask, not very frequently, but sometimes they ask. So Pharyngean cap is also important, you must know about that. And then of course the layer of gallbladder. Okay, there are four layer of gallbladder, you must know about that gallbladder layer. And the what to say, the valve of the gallbladder, you know, the valve of the gallbladder you must know. And then what to say, in the gallbladder what is left, like the strawberry gallbladder. Of course strawberry gallbladder is very important, you must know about it. Gallbladder carcinoma is not very important for us, I mean the for the fmge examination, but okay, I mean if you can you must go for that. So this was all about the gallbladder. I think this is enough. So read about this all topics from the liver chapter, and go with your p/q. I mean the whatever is given on your app, whichever app you are following. So I think this is enough for the, I mean the, to solve all the previous year questions, and even the maybe a newly built question also you can solve if you are prepared with this much I mean the subtopics of the liver. This is enough. So in the next video we will see about the spleen. Spleen is not too much large, is very important. We have already seen in the splenic trauma, we have already seen. So in if you talk about the spleen, I mean splenic trauma is the one thing that you must know. Okay, must know. After that if you talk about the how to manage the splenic trauma, their surgeries. Okay, like, I mean the splenectomy is very important. So read about the splenectomy as well from the spleen point of view. Okay, and they sometimes ask about the vaccine, like in the splenectomy we give the vaccine to the pediatrics age group patient. Okay, so they ask you about the vaccines when we give the vaccines, like if accidentally we do the like in emergency case we do this splenectomy, you do not have time to give the vaccine. So in that case what will you do? And if you have time, like the planned surgery, in the planned surgery what will be the ideal time to give that vaccine? Okay, and there is the topic that is known as the OPSI. Okay, OPSI is very important, opportunistic infection in the splenectomy, after splenectomy. So read about the OPSI as well. We have the 3 organism. Read about that organism, and just name of that organism is enough. Okay, and the vaccine. So this is all about the spleen chapter. It is not too much. Spleen is mainly from the anatomy. If you can read, go to the anatomy and read about the anatomy of the spleen, and of course histology of the spleen is now, of course you must study, but from the surgical point of view only this much is enough for the fmge. So this was all about the spleen as well. It is covered in this video itself. So we will meet in the next video, and we'll see this is the end of all the abdominal surgeries. Okay, so we'll see some new sections in the next video. Thank you guys, bye bye, all the best.